These people have lives as diverse as America, but they also have two very special characteristics in common. They all experienced a loss of vision due to cataracts, and they all had their vision renewed. In some cases, to levels even better than what it was before the cataract developed.
In the evenings, after it got dark, be in the car, I always complained to my wife that the dash lights didn't seem to be bright enough. And she said, "Sam, the dash lights are bright enough. I think there's something wrong with your eyes."
Over 50% of people over the age of 60, and quite a few younger than that, suffer from cataracts. In fact, cataracts are so common, it is said that everyone will develop a cataract if they live long enough. Cataracts are a disease that progressively robs a person of vision and limits their activities and enjoyment of life. The good news is that today, through advancements in technology and your doctor's microsurgical techniques, cataract surgery is among the most successful medical procedures you can have. In the next few minutes, we'll explain exactly what a cataract is. We'll show you how cataracts can affect your vision, and we'll explain the advances over the years that now make it possible for your vision to be restored to levels as good as it was before your cataract, and in some cases, better. Let's begin by considering how the normal eye works. An image begins as rays of light reflected from a scene. The light enters the eye through the clear dome-shaped cornea, passes through the pupil, and travels through the lens of the eye. It is then focused on the specialized nerve cells of the retina. These cells convert the light to electrical signals and sends them to the brain, which interprets these signals as vision. A cataract is a progressive clouding of the eye's natural lens that interferes with the light passing through the lens to the retina. Sufferers usually describe the condition as being similar to looking through a waterfall or a piece of wax paper with a gradual blurring or dimming of vision. Reading may become more difficult, and driving a car can actually become dangerous. Cataract sufferers may also be troubled by a bothersome glare or halos around lights. Frequent changes in eyeglass prescriptions may help at first, but as the cataract becomes progressively worse, vision will remain diminished. There are no medical treatments available to reverse the development of a cataract. Although some cataracts are caused by trauma and are found more frequently in patients with other diseases, such as diabetes, most cataracts develop as a normal part of the body's aging process. Once they form, there is only one way to eliminate their symptoms, and that is to remove the cataract from the eye. In your parents' or grandparents' day, cataract surgery was considered risky and was usually postponed for as long as possible. Hospitalization was usually required for a week or more, and complications after surgery were frequent. Many months after the surgery, patients were fitted with thick, distorting cataract glasses or cumbersome contact lenses, compromising both their appearance and their vision. In the late 1970s and early 1980s, new microsurgical techniques enabled cataract surgeons to perform cataract surgery in the morning and send the patient home the same day. Another dramatic improvement saw cataract glasses and contact lenses replaced by tiny artificial lenses, which could be implanted in the eye at the time of surgery. Doctors developed techniques to remove the cataract through smaller incisions, which speeded up healing and vision recovery. And they learned that they could eliminate many vision-threatening postoperative complications by leaving intact a thin tissue called the capsular bag, which surrounds the natural lens inside the eye. Today, according to the American Society of Cataract and Refractive Surgery, 98.3% of all cataract patients have their vision successfully improved after cataract surgery. The trend toward smaller incisions and speedier postoperative recovery continues. Now, success in cataract surgery is often measured by how well a patient sees after surgery. A number of technical and surgical breakthroughs have made this possible. Before surgery, your doctor will use an instrument called an A-scan to determine the prescription of the intraocular lens to be implanted. For many who are nearsighted or farsighted, this technology offers the possibility of clear vision without thick glasses or contact lenses for the first time in many years. It is still common, however, to fine-tune vision with glasses after cataract surgery, especially for reading or driving. Your doctor specializes in an advanced surgical technique called phacoemulsification, or small incision cataract surgery. After the eye is anesthetized and dilated, your surgeon makes a small microtunnel incision about 1/8 of an inch wide into the side of the cornea. Then, the thin capsule that surrounds the cataractus lens is carefully opened in a procedure called a capsulorhexis. Next, the cataract is gently broken into microscopic pieces using sound waves. At the same time, the fragmented cataract is softly vacuumed from the eye. The thin capsular bag remains in place. This tissue serves as a bag to hold the intraocular lens in place. A soft, foldable lens implant is inserted through the initial micro-incision and positioned inside the bag. The incision seals itself without the need for stitches. This type of self-sealing tunnel incision is stronger than conventional incisions that require stitches. The incision remains tightly sealed by the natural outward pressure within your eye, and the smaller incision means less surgical trauma to the eye and a faster and much more comfortable recuperation. You will go home soon after surgery, and you should be able to relax and enjoy most of your normal activities that same day. Although cataract surgery is one of the safest procedures done in medicine today, no discussion would be complete without at least mentioning some of the possible complications that could occur both during and after surgery. Although rare, these complications include infection, which could cause loss of the eye, loss of vision, inflammation, retinal detachment, swelling and clouding of the cornea, bleeding within the eye, swelling of the retina, double vision, IOL decentration and removal, glaucoma, and irregular astigmatism. If you have any questions regarding these risks or would like additional information on other risks that have been associated with cataract surgery, please ask your doctor. Everyone heals somewhat differently, but many cataract patients report improvement in their vision almost immediately after the procedure. Most patients return to their normal work and lifestyle routines within a day or two.
I was flabbergasted at the bright colors, as if everything got a brand new paint job. Brighter color, fluorescent practically. It was quite an experience, brand new vision. So I talked to my doctor and I said, when can we do the next one?
If you suffer from cataracts, there is something you can do about it. The time to have a cataract removed is when you believe your quality of life would be better if you could see better. Don't miss out on the things in life that are most important to you.
I was back playing professional music within a week. There's no problem. And I could see so well, the music must have picked up a little too. I'd tell everybody to go and get it done. Don't put up with poor vision, because if you could see real well when you're 30 and 40, you can see that well again.